Hello, welcome to the video. Today we are going to be discussing service learning. Service learning is a type of instructional teaching method. My name is Gabriela Ragozin, and let's get started. So what is service learning? Service learning is an approach to learning, and often it is used to address the needs of the community. And education is often integrated with a service activity. So service learning is commonly used in nursing schools to teach nursing students how to apply information that they learn within the classroom setting to a practical setting. So a student perhaps could decide to do a service learning activity at a homeless shelter to provide health assessments to people who are newly homeless and that don't have access to health care. This activity will benefit the student by allowing them to practice their practical skills and apply the information they've learned in the classroom to a practical setting where they can assess patients. The people who are perhaps newly homeless will also benefit from the service by having access to healthcare and being able to have a medical assessment done on them. Service learning can also be thought as reciprocal learning, so it benefits the person providing the service and also the recipient. So like I said in my example, a nursing student is benefiting from being able to practice the skills that they've learned in the classroom, and then the recipient is able to have that access to healthcare and be able to have a medical assessment done on them. So here's a little visual representation of kind of some of the steps that take place during service learning. So often there's a pre-service reflection. This is where someone may focus on what they think might happen during their service learning, what they expect to learn, and what they expect to get out of it, basically. And then during the service learning, they're also continually reflecting on what they're experiencing, what they're learning, and how they're going to apply that. And then there's also usually a post-reflection type of thing that happens, where someone kind of reflects on the things that they experienced, what they learned, what their reactions are, how it helped them to learn something, or if they learned something new. So those are kind of some of the steps that take place with a service learning type of project. So there are three different domains of learning, and the first domain that we're going to cover is the cognitive domain of learning. So when we think of cognition, we think of memory and knowing information, understanding, and this is the thinking domain. So when someone is able to process and apply information, that is the cognitive domain. So a nursing student, for example, could learn something in the classroom, such as the signs and symptoms of hypoglycemia, and they can maybe do service learning in an area where there's lots of diabetic patients, and they can observe different signs and symptoms of hypoglycemia or hyperglycemia, and then they can process the things that they've learned from education and then also what they're experiencing during their service learning, and they can apply that in a practical type of way and develop that memory and understanding of the information. The next domain of learning that we're going to discuss is the affective domain. This domain is dealing mostly with emotions and thoughts, feelings that people experience, and often this is a difficult domain of learning for educators to tackle in a traditional classroom setting. But through a service learning type of instructional teaching, a individual has the opportunity to go out into the world and actually experience situations that they might not experience in the classroom, and they can develop their own thoughts and feelings about what they're doing. So, experiences that happen through the service may facilitate effective learning. For instance, a medical doctor student might be taught different things about death, dying, and bereavement in the classroom setting, but may have no real idea about how they feel about actually watching a patient die, or what their feelings are about the situation that is taking place. So being able to actually perhaps go out and provide a service in a hospice setting, they might be able to experience and develop that effective learning by working with patients who are actively dying, and they can develop their own thoughts and feelings about that. The last domain of learning that we are going to discuss is the psychomotor domain. Psychomotor domain combines affective and cognitive learning domains. And this is thought of as the skills domain. So basically, doing different skills. So when going out and doing a service learning type of project, someone is able to perfect their skills by actually practicing them. So, as another example, a nursing student could volunteer at a clinic that is dealing with patients that have HIV or AIDS, and they can work on their assessment skills by actually being able to assess patients while also providing a service to the patients that benefits them. Another example could be a patient teaching another patient a new skill. So not a skill that's really difficult, but perhaps something like a patient with a new ileostomy teaching another patient how they change their ileostomy bag, and kind of like providing that peer like learning and support. So there's pros and cons to service learning. There's a lot of pros though. The first one is that it benefits others in need. So you get to provide a service to others and when they need it, and that can be really life-changing for that person that needs the service. You can also solidify your understanding of the material that's learned, and you can have a practical application of what you learned in a classroom setting. And it can be fun if you enjoy the area that you're serving in. Some cons is that every experience may not be positive. You can work in challenging environments, perhaps work with challenging people that aren't keen of having people who are learners. And there could also be some poor collaboration. Perhaps the institution that you're trying to do the service learning through might not be very cooperative or supportive of having students, so that can also be difficult. Using service learning in healthcare education with patients, this can be providing prenatal care or education to low-income mothers. So just providing any kind of service that is needed to a patient. Nursing students can also, for example, as like a peer-to-peer example, they could create a stress reduction presentation or course for peers. So, they can provide a service that is needed to their peers while also learning about the importance of managing stress themselves. And then you can also use service learning in the community by providing health screening events or participating at food banks or homeless shelters to provide that teaching and service that may be needed in a community type of setting. Thank you for watching the video. Here are my references, and have a nice day.